When somebody enrolls into Medicare, first, they often find out that it's not free. Second, they find out that it doesn't cover everything. And third, when it comes to figuring out which Medicare prescription drug plans cover which drugs that they need, it seems like they all sort of do, and they also then again sort of all don't. You gotta love those quirks of Medicare prescription drug formularies. No? It's just me? This is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it does really help our channel grow, but also because it'll help to keep you up to date of the newest Medicare changes, the newest Medicare options, and ways to make more, better, informed Medicare decisions. All right, here we go. So in the past videos, not many episodes long ago, we had begun talking about some of the aspects of Medicare Part D, or PDP, or Medicare Prescription Drug Plans. Those are all the same name. Specifically in that video, we were talking about the different stages that a person goes through as they get their drugs throughout the year. If you haven't seen that one, check it out. It gives a lot of great info about how yearly spending on Medicare prescription drug plans work, because it really isn't intuitive. But in this video, I want to talk about another very specific and important aspect of Medicare Part D plans, which is the list of drugs that are covered by a plan and how those costs vary pretty wildly, in fact, from one PDP plan to another. Now, just real quick, let's do a brief crash course on why Medicare Part D plans even exist and why somebody would want to even consider enrolling in them. Medicare Part D plans primarily exist because although Original Medicare is an amazing program, like one of the best programs to ever existed in public health, it doesn't cover everything. Original Medicare, which is composed of two parts, Medicare Part A, which covers hospitalization, and Medicare Part B, which covers more daily routine cares, make up Original Medicare. The Medicare Part A portion doesn't usually have a cost associated with it monthly, because most Americans who are enrolled in Medicare Part A have already paid into the Medicare tax for a minimum of 10 years or 40 quarters while they're working through their payroll tax. The Medicare Part B portion, though, does have a cost of $174.70 a month in 2024, regardless of how long somebody works and pays into the Medicare payroll tax that is paid monthly. So although both Medicare Part A and Part B are great, we've established that, there is one big, hairy thing that is not covered under Medicare Part A and Part B, which is medications. Medicare Part B may cover some very specific medications that are utilized under supervision of a doctor in the doctor's office, but neither Medicare Part A or Part B are going to cover medications that someone gets prescribed and then goes to the pharmacy to pick up, which I guess didn't seem like a big problem when Medicare was invented. I don't know why they wouldn't include that in there. It seems kind of obvious. But if we fast forward to the modern day, prescription drug costs now are getting frankly out of hand. And that is the reason why there is a Medicare Part D plan. They are insurance coverages for Medicare beneficiaries that are run by private health insurance companies, many of which we know, and quite a few that you probably don't, like super indie, sort of like boutique Medicare drug coverage plans. But these plans, whichever the ones they are, help to cover some or almost all of the cost of beneficiaries' prescription medications in exchange for a monthly and additional premium, on top of what folks pay for their Medicare Part B, and if they get a Medigap on top of all that. Now, that being said, these Medicare prescription drug plans cover medications, like you would think, but although all Medicare Part D plans have to cover medications for all ailments that are coverable under Medicare, they don't have to cover every medication that is covered under all ailments under Medicare. Which means that if there are, say, for example, 5 drugs for asthma, the plan can choose maybe just 2 or 3, or all 5 if they want to, but they don't have to choose all 5. They could stay with just 2. Additionally, each insurance plan negotiates the prices for specific drugs individually, meaning that some drugs on Plan X are not going to be exactly the same cost as they are on Plan Y. So let's dive into an example of these nuances for the differences in cost and drug availability for prescription drug plans. How we're going to do this is we are going to look at 2 separate Medicare Part D plans. And like the Carnival in Venice, we're not going to use any names, but we are just going to be using these as an example for how formularies and plan costs are related and can affect a person's Part D choices. So first up, let's bring up plan number 1, which, as we can see, has their drug coverage made out into tiers, with the lower tiers being less expensive with copays up to the higher tiers, tier 5 in this case, with co-insurances rather than copays, meaning that the beneficiary has to pay a percentage of the cost of that drug rather than a flat fee or a copay. Also note that tier 1 is a preferred generic medication, which is the non-brand name version of that medication, but it is less expensive than the tier 3 medications that is the brand name version of that medication with all the fancy packaging, but the cost to go along with that. Think Cola as tier number 3 as the brand name, but RC Cola as tier number 1. Both good, but definitely not the same. So in this specific plan, the cost for prescriptions picked up from a preferred retail establishment for a month's supply is a $2 copay for a tier 1 medication, a $35 copay for a tier 3 medication, and a 37% coinsurance for the cost for a tier 4. If we look at the separate Part D plan like we have here, then we can also see that for a monthly supply at a preferred retail pharmacy, a tier 1 medication has a copay of $1, and a tier 3 has $45, and a tier 4 has a 49% cost sharing or co-insurance. So firstly, and rather plainly, we can see that the cost for medications can be pretty different from one plan to another, even if they are considered the same tier level, whichever level that happens to be. To add complexity to this, it is important to note that plans negotiate the cost of drugs differently and may have the same drugs on their formularies, but at different tiers depending on the plan. So let's take an example of metformin, which is a very common medication that folks on diabetes or who have diabetes typically takes. And for on plan 1, metformin could be considered a tier 2 generic medication. So the cost for that would be $8. Comparing that side by side with plan number 2, then we can see that if it was considered a preferred generic medication, then the cost for a 30-day supplies is going to be $1. So the difference is $7, which isn't a lot for one single medication, but those numbers can grow exponentially when there are more medications added into the mix dependent on the tiering. So that is the first set of variables, which is which tier level each and every prescription drug is at on a specific PDP plan. Now, if we want to throw a Y into this equation and turn it into an algebra problem, there is an issue of which medications are covered under which plan. Like I said before, each plan must have a medication for each type of covered illness, but they don't have to have all of them. That means that in practice, a person may take one type of metformin in this case and need that version of it specifically, but can only be covered under one of the 2 plans or only a handful of plans. And then again, it might even be at different tier levels, really making the cost and the plan decision very impactful on a person's budget and driving basically somebody crazy to make sure that all the bases are covered and all the medications are covered at the least expensive price. And lastly, to throw one other aspect into this whole equation, really turning it into a Rubik's Cube of a problem, is the fact that aside from copays and coinsurances that somebody has to pay for medications when they get their prescriptions filled, there's also a monthly premium that has to be paid as well, regardless of the medication cost or the medication usage. In this case, one of these plans costs around $90 a month and has to be paid on top of that Medicare Part B premium, and the other plan has a cost of around $130 a month. Again, these are just more considerations that ultimately have a big impact on somebody's budget, on somebody's health, and on somebody's plan choice. So if we're going to break this all down, making a decision about a Medicare prescription drug plan revolves around, in no particular order, the formula of the list of drugs that are available within that plan, the tier level which those drugs are at, or the cost of those medications, and how much they cost monthly. Oh, and these can change every year, the cost and the tier levels and the medications. So yeah, there's that aspect as well. But that about covers the basics of the considerations of a Medicare Part D plan. By starting to throw in 1, 2, 4, and sometimes even a grocery bag full of medications can make these decisions even infinitely more complex by orders of magnitude. And maybe at that point, if you have lots of medications and you're not sure, might I humbly suggest it's a good time to find some professional help. With all that being said, if you are in a situation where you're trying to figure out what is a Medicare prescription drug plan that may work out best for you and your family members, or maybe a family friend, whoever it may be, and you're not sure what to do, feel free to reach out to us at the information down below, or leave a comment, or you can even just check out our other great content on YouTube and Instagram about Medicare. Speaking of which, don't forget to like and subscribe so you can get updates when our newest videos come out. So with that, I am Michael from Michael's Medicare, hoping that you have a great rest of your day, and goodbye.